Okay. Hello, my name is Charles Jackson, and I will be conducting a um, audit tool to determine your alcohol, tobacco, and drug use. This tool is called the TAPS tool, and I'll go into more detail in a moment. Do you have any questions for me?
Not at the moment.
All right. Can you state your name
Fati Adebo,
and your age?
50.
All right. Thank you. Now, this is a one-on-one counseling session where we do an assessment. Therefore, please be honest and open with your answers. And the information gathered in this brief will only be for clinical use only. All right. Now, like I said, we'll be doing a tobacco, alcohol, prescription medication, and other substance use tool. I'll read the questions to you and please answer as openly as possible. If you have any questions, please let me know and I'll check in with you as we progress.
Okay.
In the past 12 months, how often have you used tobacco or any other nicotine delivery product? For example, cigarettes, vaping, chewing, or chewing tobacco.
Cigarette twice a week.
In the past 12 months, have you had five or more drinks for men, four or more drinks for women containing alcohol in one day?
Yes.
Would you say daily, almost daily, weekly, monthly, or less than
Almost
monthly?
daily.
In the past 12 months, how often have you used any prescription medications just for the feeling more than prescribed or that were not prescribed for you?
Never.
In the past 12 months, how often have you used any drugs, including marijuana, cocaine, crack, heroin, methamphetamine, hallucinogens, ecstasy, or MDMA? Daily, weekly, monthly, less than monthly, or never?
Never.
Last 3 months, did you have a drink containing alcohol?
Yes.
In the past 3 months, did you have five or more drinks for men or four or more drinks for women containing alcohol in one day?
Yes.
In the past 3 months, have you tried but failed to control, cut down, or stop your drinking?
Yes.
In the past 3 months, has anyone expressed concerns about your drinking?
No.
Okay, thank you for taking the survey. Do you have any questions about or would you like to elaborate about any of the questions?
No, thank you.
Okay. All right. The survey grades you at alcohol risk level high for alcohol use disorder. So patients with this result are at high risk for adverse outcomes related to alcohol use and are highly likely to meet DSM-5 criteria for alcohol use disorder. Would you mind if we do another identification tool?
No.
Uh, okay, excellent. This tool is an audit tool. It stands for Alcohol Use Disorder Identification Test. This is a 10-item screening tool developed by the World Health Organization to assess alcohol consumption, drinking behaviors, and alcohol related problems. This is a clinician administered version, and there's a self reported version. Um, would you like to answer the questions on paper, or would you like me to ask you the questions?
Ask me the questions.
All right, perfect. All right. And just so you know, that a score of eight or more is considered to indicate hazardous or harmful alcohol use. This audit has been validated across genders and a wide variety of racial ethnic groups and is well suited for the use in primary care settings. And there are detailed guidelines on the website for the World Health Organization. All right, let's get started. Now I'm going to ask you some questions about your use of alcohol beverages during the past year. And by alcohol beverages, we're going to utilize this chart, meaning A beer or a cooler at 12 ounces, which has about 5% alcohol. Malt liquor, 8 to 9 ounces. That's one drink. These are all one drinks, which is 7% alcohol. Table wine at 5 ounces is 12% alcohol. 80 proof spirits, 1.5 ounces at 40% alcohol. There you go. Do you have any questions about the amounts?
No.
Okay. Now, how often do you have a drink containing alcohol? Never, monthly, less than monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 more times a week. How often do you have a drink containing alcohol? Never, monthly or less, 2 to 4 times a week, three, 2 to 3 times a week, 4 more times a week.
4 more times a week.
Awesome. How many drinks containing alcohol do you have on a typical day when you're drinking? 1 to 2, 3 to 4, 5 or 6, 7, 8 or 9, or 10 or more.
1 to 2.
Number two, how many drinks containing alcohol do you have on a typical day when you're drinking? Zero is 1 to 2, one is 3 to 4, two is 5 or 6, three is 7 or 8, 7, 8 or 9, or four is 10 or more.
1.
How often do you have six or more drinks in an occasion? Zero being never, one is less than monthly, two is monthly, three is weekly, four is daily or almost daily.
3.
All right. And four, how often during the last year have you found that you are not able to stop drinking once you have started? One or zero is never, one is less than monthly, two is monthly, three is weekly, four is daily or almost daily.
1.
Right? Five, how often during the last year have you failed to do what is normally expected of you because of your drinking? Zero is never, one is less than monthly, two is monthly, three is weekly, four is daily.
0.
Okay. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session? Zero is never, one is less than monthly, two is monthly, three is weekly, four is daily.
1.
All right. How often during the last year have you had a feeling of guilt or remorse after drinking? Zero is never, one is less than monthly, two is monthly, three is weekly, four is daily.
0.
How often during the last year have you been unable to remember what happened the night before because of your drinking? Zero is never, one is less than monthly, two is monthly, three is weekly, four is daily or almost daily.
0.
How have you or someone else been injured as a result of your drinking? Zero is no, two is yes, but not in the last year, four is yes, but during the last year.
0.
Have a relative or a close friend or doctor or another health worker been concerned about your drinking or suggested you cut down? No, yes, but not in the last year, or yes, during the last year.
0.
Okay. Okay, let me do a total up over your results and we will I'll go from there. Let's see here. Four, five, six, seven, eight, nine, yeah. Okay. That would give you a 10 um, on the scale. All right. And what that means is a score of 8 to 14. Well, the range of possible scores are 0 to 40, where 0 indicates an abstainer who has never had any problems with alcohol, and it goes all the way up to 15 or more, which indicates the likelihood of alcohol dependence and moderate to severe alcohol use disorder. You have scored a 10. Scores from 8 to 14 suggest that hazardous or harmful alcohol consumption. And my recommendation to you, or do you have any questions about the score that you received?
No.
Okay. Um, what do you think about the score you usually? Do you think that you drank that much?
I don't think that I drink. I'm alcoholic. I just drink when I get home from work, stress. Just get a couple of beers and that's it. So I'm not alcoholic. That I think I need help.
Okay. Okay. Well, for the next uh, step in the process, since you've finished the paperwork, I would like to refer you potentially to um, a class that helps people deal with stress and coping skills while at work and in life. They can address potential burnout or um, fatigue at your place of employment, or maybe just coping skills or different other methods of relieving stress once you get off of work. What do you think about that?
That will help. I will appreciate it.
How often or when do you think we'd be able to start something like that? How soon you do
I
be
will.
comfortable?
I would say within a week.
Okay, so today being Sunday, how about we look at reducing the amount of drinks that you have over the next week? And by Friday, let's reduce that by 2 to 3 drinks. Instead of having as many as you have, which you recorded as 4 or more times a week, let's cut that down to 2 times a week. Do you think you can do that?
Yes, I'm looking forward to um, doing that.
All right. Well, thank you for your time and you have a good day.
Thank you.
This is my commentary on the video just shot. The question is, what did I do well? I believe that I was clear and took the time to explain the procedures for the audit tools prior to giving them, and gave a decent assessment of and a plan of action after the recording. Um, what would I do different if I had a do over? If I had a do over, I would print out the questions. I was reading it off of the computer, which caused me to kind of use my peripheral to look at the individual. Um, in general, I would like to have a face on heading, or maybe even memorize the questions to the degree where I would only have to reference the paper to ask the questions. Also, the setting would be nice if we had a wider angle where we were literally facing each other, and that would have been a little more comfortable. Describe your comfort level, asking the questions and offering feedback and giving education. It was a little awkward. I believe that the way that the questions are structured, having to read it word for word, left room for the mistakes and stumbling. But that also goes to my familiarity with the questions and um, my comfort level with asking those questions to the individual. What was the most challenging part of this interaction? The most challenging part of this interaction was getting the um, person that I was interviewing to share more. She opened up at the end, but that also is based on the type of questions that I was asking. The question air doesn't really leave a lot of room for exploration, but outside of that, I think it went well.